My name is Celiwe Dlamini Ndlovu, and I joined MSF HIV project in KwaZulu-Natal in South Africa since 2011 October. Okay, here in the slides, it's one of the project catchment area where we work. I wanted to highlight so that you can see that the infrastructure is not that good in our project. The households are scattered, and I mean, as you can see, there is no health facility structure that is appearing in this picture. So it tells us that our patients need to walk a long distance to go to the facility. I've joined our project in 2011. My main role is that I was a counselor mentor at that time. I was providing counseling to patients with HIV and TB. And our project is supporting 9 health facilities which belong to Department of Health. And the facilities that we are supporting are in a rural context and urban as well. So I'm happy that I had the opportunity to work in that project because it's a great project. We are making a huge improvement to patients' life. So my role has been focusing on providing education and psychosocial support to all patients who are visiting our health facilities. And more so, I also provide trainings and mentorship to Department of Health lay counsellors to ensure that standards and norms of education and counselling are implemented in a good manner in all health facilities. My experience as a counsellor, I've seen and heard patients coming up with different challenges that they face in their daily life when they are tested HIV positive. I will just share a few stories that I've heard and listened that were said by the patient. One old lady said, "I will not disclose my status to my husband because he might say I came with HIV." So this old lady tested positive and willing to start treatment, but she could not disclose to the husband because she has fear. And another one is saying, a young bride end up mix feeding her infant, knowing exactly that she's putting her infant in a risk of getting HIV. Her reason was that my mother-in-law is saying, breast milk is not enough for my child. If I do not allow, and she also said, if I do not allow my mother-in-law to give my child something else, she will suspect that I'm sick. And another one, in our facilities, as I've mentioned, that we are supporting 9 facilities, which are in different areas. So we find that many of our patients are on ART, but they do not know how do we monitor the treatment success, and they do not know how to interpret their blood results. They will take blood, but they don't know what is it for. So those are the challenges that our patients are facing on daily. And then we have a huge number of children who are in care in our clinics, but they do not know what treatment are they taking is it for. There is one incident which was very touching for me. A 14-year-old girl came to the health facility with other school children to come to do just the HIV test. And then while we were doing counseling, the child told us that she's on TB medication. She's been taking it for a very long, her granny said it's a TB medication. And her results tend to be HIV positive. So what does that tell us? The child is already on ART, but not knowing, and the girl is 14 years old. And another last story, it's one patient who was not adhering well on her treatment. And then when we asked her, and what was the main problem, she said, I keep my medication outside of my room because I'm afraid my husband will see my treatment. These people are married, staying together, but there is fear still of the husband finding out that the wife is on treatment. As I've mentioned these few points, it's clear that patients face many different challenges every day, and lay counsellors play an important role to address through with different interventions. As we are lay counsellors, we empower patients with relevant information about the illness and its treatment. We continue providing ongoing support to ensure improvement of adherence. So we've come up with different strategies to assist patients to be able to deal with challenges in a better way. we do the following things. If a patient is tested positive, and then the CD4 is saying the patient is eligible to be initiated on treatment, firstly, we provide literacy classes. So when we do literacy classes, we share the information, we empower the patient to understand what does HIV do in his or in her body, and what will treatment do to suppress the virus. And then we also notice that even if we do those literacy classes, sometimes patients still have challenges. We started a program which is called Adherence Planning. What we do that on an initiation day when the patient is starting treatment. On the very same day, we will sit with a patient, and then we want the patient to think, why is it important for them to start treatment? What is it that will make them to live? Why they still want to live? Why they don't want to die? So they think, often we'll find that some of patients, they don't even know why they are living. They're just living. So when we do adherence planning, we make them to think, what is it? Most of them, they say, okay, I want to see my children growing up. I want to see them finishing school, or I'm still supporting my family. It's depend. Although sometimes you will find patients who are really having a difficult life, who will say, when you say, okay, what is important? What are your goals? They will say, I don't have any goals. All my family have died, I'm not working. So those are the challenges as we are the counsellors that we faced as well, and we are trying to assist our patients to be able to adhere on treatment, because the purpose of starting them on treatment is to make them to live and adhere to treatment. So we don't end there, we continue to provide adherence counselling after patients have been initiated on treatment. Why do we do that? Because we've done already adherence counselling. We know that even all human beings, you will make a plan, but it does not mean that your plan will work. Sometimes patients will have good plans, but then when they get to their families, it does not work. So we do a follow-up when we do enhanced adherence counselling to ensure that did the plan make, or we need to, did the plan work, or we need to help the client to make another plan. Should it happen that, okay, we saw the client during adherence counselling, and then time for taking bloods come, the results come back, the viral load results come back unsuppressed. We don't just leave the patient with the high viral load. We will have a session which we call enhanced adherence session. So when we do enhanced adherence session, we focus on the actual result. What happened? Does the client or does the patient understand the implications of having a high viral load? Sometimes we'll find that the patient is happy when we say your viral load is 5,000. They just smile, because it tells us as counsellors that the patient did not understand what is viral load. The viral, what is a good viral load and what is not an unsuppressed viral load. So we'll help the patient and then redo the planning. Now, what will happen? How will the patient make this viral load to be suppressed? And as I've indicated in my point where I was talking about the 14-year-old who did not know her status. As a project, we came up with the strategy of assisting the guardians or the parents in terms of disclosing. How do they go about on disclosing to their children? Because it was clear that guardians or parents, they have fear of telling their children that they are HIV positive. So firstly, we empowered the guardians and the parents with providing counselling sessions, and we also share the IEC material that is talking about the step, how do you go about in terms of disclosing. So after that part, the mother or the guardian will go home and then disclose. It's depend if they choose to come to the facility so that the counsellor will be there to support, that is allowed. So we've achieved so many of our children who are in our facilities are disclosed. After that, we start children support groups to ensure that those children who now know that they are HIV positive, they are retained to care and they adhere. I think Mark was also mentioning about the adolescents, because sometimes you'll find that when they reach the adolescent stage, they will drop out from the healthcare facilities. So with the support group, we are trying to create a good environment for them to see that they are not alone. There are also other children who are HIV positive. And also counsellors are facilitating patient clubs, which USA will deal more about, talk more about the clubs. So these things that I've mentioned are done by the lay counsellors. But now, the situation is a bit different, because today in our health, when I started as a counsellor mentor, in our health facilities, we had 30 lay counsellors that I was providing mentorship to them. But now we only have 8 which are remaining in health facilities. This is due to the fact that the authorities decided to stop the lay counsellor position, and they are expecting that the overburdened nurses are the ones who are going to provide counselling and patient education. How are they going to do that? So now, due to this change, the role of the MSF counsellor mentors has changed because they are no longer mentoring, as there are no counsellors. So, and also the nurses are unable to provide counselling and education to the patient. With this, I'm very worried that the phasing out of the counsellors affects the care of our patient. Counselling and education standards and norms are now hardly respected, as the nurses are the ones who are doing HIV testing. And we know that the nurses have a lot of tasks that they are also doing and providing to the patient. So they don't have time to do health education to our patient and to do counselling for our patient and to follow up. So I've already noticed the decrease in number of HIV testing in health facilities, and Mark showed the slide that was showing that, and also the increased number of patients who are having adherence problem. So I think I mentioned this. Okay, this is one of the pictures whereby I was doing health education. We do health education in groups or in individual cases, whereby we educate patients with different topics. It's either it's TB or it's HIV. And here, when we do counseling, we are using flip charts, which are visual aids, so that we can the patient can clearly see what we are talking about. And early this year, we hold a adherence summit for patients who are on ART, because we were noticing that patients now are presenting with high viral loads. So we wanted to find out from them, what is it? So with this summit, we really find out what was bothering the patient, and we are trying to improve, as we are the counsellors. And then, as I mentioned, that we started children support groups. So with the children support groups, they meet once a month or once in 2 months to discuss and get their medication. Here we were having a life skills workshop for them, because it was clear when we hold those support groups on a monthly basis that there are burning issues that we are not able to tackle. In this group, it's more of the ones that are adolescent. They have issues on how do they go about disclosing to their partners, because they've started dating. So here there was one of my supervisor, but she left now. She's a psychologist, so she was supporting us, because there were stories here which were discussed, which were advanced, who needed someone at a higher level in terms of counselling, because as we are lay counsellors, we are more trained on HIV and AIDS and TB. So I'm almost finished. Irrespective of all the challenges, I'm still passionate about my job, as I believe that we improve lives by being there. We provide emotional support to all patients who are HIV infected and affected. However, there is an urgent need for policymakers, donors, and Department of Health to address the lack of recognition and financial support for cadres such as counsellors who are always willing to listen and assist patients to resolve any challenges to improve their lives. Thank you.
You can sit by the table here.
Okay.
I think there is a name. Thank you very much. Yeah, in the middle, please. I actually have 2 questions for you, Celiwe, sorry. Okay. And how many patients are you attending to, basically, in your group that you are supporting as a counsellor?
Okay, depending on a day, on how many patients are coming to the facility, because they come, like, patients are given their appointment dates to come and collect medication. As I was highlighting the things that we do as counsellors. So you might find that there are patients who are already stable, they just come to collect medication, who does not need counselling sessions. But you still see, but in busy clinics, maybe you'll find that a day, the one lay counsellor will see maybe 15 or more patients. Yes.
That you are supporting with advice and trying to...
Yes.
Yeah. And I also wondered, because you told us about the mother with the infant and that she was breastfeeding due to the stigma, that she was afraid that someone would understand her not breastfeeding would mean that she actually is HIV positive. What advice would you give her?
What we've done, we provide them with counseling so that they will understand why is it so important for them to stick to the breastfeeding for a certain time that is, set by the nurses or by the doctors. And we empower them to know that if they mix feed, that is putting their children or their infant at risk. And we've started, as much as I did not highlight that, we've started to engage with the communities so that the stigma will go down, and to make the mother-in-laws to understand that it's not always the case whereby they need their brides need to mix feed. And so that if we believe that if the community understand that mixed feeding is putting risk to the infant. So we are educating the community more now about HIV, because the issue is that they don't understand like what is happening with HIV, yes. So we just believe that by empowering the community, the stigma will go down. As much as we cannot be sure that it will be finished, but we are reaching out by providing education. Yes.
Thank you very much.